Today, we are going to decode one of the most common, but, often mysterious experiences we all go through the physical exam. We're going to translate what is really happening during your doctor's visit. So, picture this. You're sitting on that crinkly paper on the exam table, and your doctor starts throwing around terms that sound like they're from a completely different planet. It's a feeling a lot of us know well, right? That little bit of confusion, maybe even a little bit of intimidation. Well, think of this as your personal translator. We're going to break down all that medical jargon so you can walk into your next appointment feeling confident, in control, and totally empowered. So let's dive right in. Okay, let's start at the very beginning, the first few moments of your visit. Because here's something you might not realize. The exam actually begins the second you walk through that door. Yep, that's right. Before a single instrument is even picked up, your clinician is already doing what's called a general assessment. They're observing how you move, how you hold yourself, even how you interact with your surroundings. One of the very first things they'll note is if you are alert and oriented. You might even hear them say something like oriented times 4, which is just shorthand. It means you're aware of 4 key things: who you are, where you are, the current date, and the situation you're in. It's just a really quick, simple check of your mental clarity. They're also looking at your gait. That's just your walking pattern, your posture, and your affect, which is basically the emotional expression they can see on your face. And of course, they're looking for any obvious signs of distress. All these little first impressions, they provide really crucial clues about your overall health. All right. Next up, we're cracking the code on vital signs. Now, these are not just random numbers they write down on a chart. They are a live report on exactly what's happening inside your body in that very moment. And really, it comes down to 5 primary vital signs that give this fundamental snapshot of your body's most basic functions. You can think of them as, like, the 5 pillars of your immediate health. And here they are. You've got temperature, pulse, or heart rate, respiration, which is your breathing rate, blood pressure, and finally, oxygen saturation. That last one is a super quick way to measure how much oxygen is in your blood. Every single one is a critical piece of the puzzle. So let's put some official names to these numbers. If your temperature is too low, the medical term is hypothermia. If it's too high, it's called hyperthermia, which, we would just call a fever. And it's the exact same idea for your pulse. For an adult, a heart rate that's too fast, so over 100 beats per minute, is called tachycardia, and one that's too slow or below 60 is called bradycardia. And these aren't just fancy labels. A really rapid heart rate, for instance, could be a sign that your body is fighting off an infection or is under some kind of stress. That's exactly why your doctor pays such close attention to it. Now for the main event, the head-to-toe examination. Let's think of this as a kind of greatest hits tour of the most common terms and procedures you're likely to run into. Have you ever wondered what the doctor is actually looking for when they shine that little light in your eyes? Well, they're checking for something called pupils equal, round, reactive to light, and accommodation. It's just a really fast, efficient way for them to note that all the nerves and muscles controlling your eyes are working just the way they should. And what about that cold metal disc at the end of the stethoscope? Well, the process of using it to listen to all your internal body sounds has a name. It's called auscultation. And they're not just listening to your heart and lungs. They can also listen to the gurgling sounds your digestive system makes. It's a truly fundamental and powerful diagnostic tool. But what's really amazing is just how precise this all is. Your doctor isn't just randomly placing the stethoscope on your chest. As you can see here, they listen at very specific spots, and each one corresponds to a different valve of your heart. This lets them isolate sounds and pinpoint exactly where a potential issue might be coming from. It's a perfect example of the incredible detail that goes into a physical exam. Next up is something called palpation. This is the official term for when your clinician uses their hands to feel different parts of your body. They are gathering a huge amount of information just through touch. They're assessing things like the size, the texture, and tenderness of your organs, or feeling for any abnormalities. So for example, when they're palpating your abdomen, they're not just pushing around randomly. They are feeling for very specific signs, like tenderness, pain when touched, or if your muscles tense up in a reaction called guarding. They're also checking for any unusual masses or for signs of an enlarged organ, which is called organomegaly. Okay, so now that we've translated some of the key terms, let's talk about what I think is the most important part: how you can use this knowledge to become a more active, more empowered partner in your own healthcare. Honestly, this is the most crucial takeaway. You can basically distill any question you have about any procedure down to these 3 simple things. First, ask why. What's the purpose of this? Second, ask what happens. What's the process going to feel like? And third, ask what's next to get clear on the plan moving forward. This simple framework makes sure you are a fully informed participant. And here is such a powerful phrase to always, always remember. You can, and you absolutely should, say this at any time. It's a simple statement that puts you in complete control of your own body. Remember, the exam is a partnership, and your consent is required for every single step of the way. So, as we wrap things up, I want to leave you with this thought. Now that you're armed with this new vocabulary and a new framework for communication, what is one question you are going to make sure to ask at your next doctor's visit? Just being prepared can absolutely transform the entire experience for you.